What causes infant mortality? There are many different causes of infant mortality, from infection to birth defects or accidents. The main causes of infant mortality in the United States are different than the main causes of infant death around the world. In addition, in the United States and worldwide, the most common causes of infant death in the first weeks after birth are different than those that occurred later in the first year. There is a difference between causes of infant mortality and contributors to infant mortality. A cause leads directly to a death. In fact, in contrast, a contributor is a risk factor that makes the death more likely to happen. Learn more risk factors of infant mortality. To reduce the risk of infant mortality, often there are no different defined way to prevent many of the leading causes of infant mortality. However, there are ways to reduce a baby's risk. Researchers contribute to study the best way to prevent and treat the causes of infant mortality and affect the contributors to infant mortality. Consider the following ways to help reduce the risk: preventing birth defects, addressing paternal preterm birth, low birth weight and their outcomes, getting preconceived and prenatal care, parental care, creating a safe infant sleep environment, using newborn screening to direct hidden conditions, preventing birth defects. Birth defects are occurred currently the leading causes of infant mortality in the United States. There are many different kinds of birth defect and they can happen in many pregnancies. There are several things pregnant women can do help reduce the risk of certain birth defects, such as getting enough folic acid before and during pregnancy to prevent neural neural tube defects. Learn more about the risk factors of defects, addressing maternal birth, low birth weight and their outcomes, getting preconception and parental care, creating a safe infant sleep environment, using newborn searching to detect hidden conditions. Causes of infant mortality in the United States: birth defects, paternal birth and low birth weights, sudden infant death syndrome (SIDS), pregnancy complications, and accidents. Causes of infant mortality world. Globally, the top 5 causes of infant death in 2010, the most recent year for which data were available, were the following: newborn encephalopathy, pronounced encephalopathy, a problems with the brain function after birth; neonatal encephalopathy usually results from birth trauma or a lack of oxygen to the baby during birth; infections, especially blood infections, complications of pretermal birth; lower respiratory infections such as flu and pneumonia; diarrheal disease. This ranking is an average for all infant mortality from birth to age 1. It does not reflect the fact that the major causes of death in oral infants are different from those in younger infants. For example, birth defects are a top cause of death already the death just after birth, but not among older infants. In contrast, malaria is a top cause of death around the world in infants older than 1 month of age, but not in younger infants. The top five causes of global infant mortality are the same for 2010 as they were from 1990. However, deaths from certain causes dropped dramatically in those 20 years. In particular, many fewer babies died of low respiratory infections and diarrhea disease in 2010 than did in 1990.